This bill is for the Department of Corrections and their health care. I spent a lot of time this summer going from prison to prison and in being in contact with a lot of people. This is what we came up with. The Department of Health shall have the authority to conduct a comprehensive review of the medical care provided to its inmates of the Mississippi Department of Corrections and its comprehensive correctional health care services. Right now, we signed a new contract that went into effect October 7th, and today the Department of Corrections, with all their medical experience, is oversight to their health care. In performing such a review, the Department of Health shall have access to all files, records of the Department of Corrections and their contractor who is providing their health care. Any facility where the Department of Corrections renders medical care to inmates, including state penitentiaries, state correctional institutions, privately managed prisons, regionals, jails, hospitals, clinic, and county jails where the state inmates are being held in custody. All physicians, nurses, and other persons who are involved in providing medical care to inmates of that department, the Department of Health will have access to. In performing this review, the Department of Health shall have the authority to use existing staff of the Department of Health and to engage any contractor necessary to complete the review, including but not limited to physicians, nurses, and other medical and non-medical staff as required by the state health officer. The review shall focus on quality of medical care rendered to inmates, including but not limited to patient outcomes, inmate access to medical staff, and shall further address the adequacy and fitness of any facility wherein services are rendered. The Department of Corrections, its staff, sheriffs of counties housing state inmates, regional jails, wardens, personnel of private prison, and all the staff and contractors involved in providing health care to the state inmates shall cooperate with the Department of Health in conducting this review. Upon the completion of the review, the Department of Health shall provide copies of its review and report to the Speaker of the House, the Lieutenant Governor, the House and Senate Chairs of Correction Committee, the Chair of Senate and House Public Health and Welfare, the Chair of the House Peer Committee, not Chairman, just Peer Committee, and the Department of Corrections. The Department of Health will do a comprehensive correctional health care services, establish a hepatitis C program for the state inmates. You know, they do the tuberculosis care and they manage that quite well. We don't have any outbreaks of tuberculosis in prison, and I want them to do the same type of program for hepatitis C. The Department of Health shall develop a plan for improving women's health. We don't do pap smears, we don't do mammograms, we don't tend to women's health. We have pregnant women, and we're going to make sure that they're taken care of. I did a lot of these after talking to many inmates. Inmates right now, if they ask to see the physician or nurse practitioner, they are charged $10 a visit if they receive medicine and $6 a visit if they do not. We pay for their health care. Last year we paid $109 million, and this year it's going to be $119 million, and we're asking someone who has no money to pay for health care. And that will stop as soon as this bill passes. There shall be available in each housing unit a kiosk or pad, but what I'm looking for, what I need to happen is that once that inmate asked to see a medical provider, that goes electronically to the medical provider. There are stacks of paper this tall for inmates having to fill out a piece of paper. Sometimes they get there, sometimes they don't. Sometimes they make it, sometimes they don't. Inmates are still, if they didn't get to see the doctor, still charged the money. So we're going to make it a kiosk, and I'm asking in this bill to make it a legal part of their medical record. If they didn't get seen, we want to know why. And also within 24 hours, every medical person in the world, much less the state, knows that you triage those sheets when you get them. If somebody's having chest pain, that's real different from the one that's having athlete's foot. But the word is triage, and we need to be using it. If the state inmate is disabled or has difficulty walking, right now they're having to somehow get their food and their medicine way in other buildings, and I want some kind of program set up for inmates that are disabled. We have inmates on hospice. We have different types of inmates that aren't able to get up and walk to get their medicine and their food, and the Department of Corrections is to come up with a plan along with their provider to do that. Another problem we have is that their contractor gets there in the morning, and most all inmates go to a class, a GED class. They work. They're in trying to get their certificates of welding. You know, we're doing a great job of making sure they're not idle. But yet, when they get up, have their breakfast, and go off to work, then by the time the medical people arrive in the building, they're gone. And they may not get their diabetes medicine or their antipsychotic medicine or their COPD or whatever it is they need to live. They're going off into work and not receiving that medicine. We're going to settle that. We're going to have them get their medicine and move on about their day. Then about 3 or 4 o'clock, they're getting ready to go home for the evening, and these folks, these inmates are still out working or in class, and they give them their nighttime medicine so they can go home. We're going to give medicine at the appropriate time that is prescribed, and we're going to make sure that they're not working on heavy equipment on their nighttime medicine. We're going to assure that they're going to be in their class to learn their A&D program and their GED or whatever they're going to, and they're not falling asleep in class. I have a few more things to say. Sorry, you can wave that flag all you want to, but this is my bill and my time. The Department of Corrections shall hire a dietitian. I think they have one in a contract. I'm just trying to make sure. If you're on dialysis, folks, we have patients on dialysis. They have to have a special meal. You have a diabetic, they have to have a special meal. So I need to make sure that they're getting the meal that we're going to be able to do no harm, as medical people are vowed to do. There shall be a nurse there 24 hours a day. It can be an LPN, but we're going to have a nurse there. Healthcare doesn't stop at 4 o'clock every day and 4 o'clock on Fridays. There's a whole lot that goes on in state facilities, and we're going to make sure somebody is there to make a decision. I don't care if they sleep when nothing's going on, but we're going to have somebody there, and I'll give you a little example. We had an inmate that took some medication that he wasn't supposed to, some drugs, let me just say it, and he actually was having a panic attack, but he thought he was having a stroke. So there's no medical person there at all to determine what's going on. They call an ambulance, and the hospital sends a $50,000 helicopter. He rides in the helicopter to the hospital, and 2 hours later, they bring him back in the van because he's okay. But triage needed to be done for the state of Mississippi not to have to pay that bill. Now, I'm finally done, but I want to thank the speaker because he has stood with me, and he said, I gave you this position to fix it, and this is me fixing it. Now, I'm also going to say something else. So, the governor wants to hire an outside firm, out-of-state firm, to come in here and do this. You know, the out-of-state firm that wrote this contract got us in the mess we're in now with no oversight. I don't want an outside firm. I want to know what's going on, and I want to know that we fix it. So I'm asking you to please, let's fix this once and for all, and this bill is a great start, and I hope he'll let it pass. And that's my explanation of the bill.
Thank you, lady. I see some questions on the bill, but I'm going to recognize the lady from Humphreys, Ms. James Jones. She's been waiting a long time, and I missed her for an introduction out of order.
Thank you, Mr. Speaker. We are so pleased to have in the North and the South Gallery the Mississippi Women's Economic Security Initiative and the Black Women's Roundtable that are both in the North and the South Gallery. They are here today to remind us to secure the bag, and we want to make them feel welcome as they're here. Thank you so much, Mr. Speaker.
Welcome. Thank you, lady. All right, questions on the bill. Gentleman from Hines, Mr. Brown.
Thank you, Mr. Speaker. Madam Yield.
Yes, sir.
I have been submitting a bill every year to enhance the mental health availability for released inmates from Parchment. Well, from all of the prisons, I guess. And I must agree that you've been a hero for mental health, and you've been a hero for prison reform. But I would like for you to tell me why no mental health has been mentioned in these reforms that you are discussing and that you're submitting for us to approve, which is great. But we all know that one of the biggest problems that the inmates have, particularly the ones that's being released, is mental health situations. And secondly, are we going to be able to serve the whole prison population with these programs you're advocating? Or are we going to have an eligibility requirement that's necessary to serve a certain segment of the population, inmate population? And then thirdly, what about the guards inflicting a lot of these mental health situations themselves? We understand that a lot of the prisons are being mistreated by the guards, creating health situations. Are you aware of that, madam?
I didn't understand the last sentence. I'm going to be really honest with you.
But the last part I'm saying, a lot of them are being mistreated by the guards themselves to create health problems. Are you aware of that?
Yes, sir.
And what about that mental health?
Well, let me tell you that I have been in meeting with Wendy Bailey, our executive over the mental health department, and I told her this is the anniversary of my first year to be over corrections. So I told her next year that we need to contract with mental health, whether it be that we have their psychiatrists, their psychologists all make rounds, whatever it is we need to do, because you're correct. About half of our population has a mental health problem, and it needs to be addressed. I need to get in there first and see what's going on, and then I'll be in a better position next year to contract with the Department of Mental Health.
Gentleman from Hancock, Mr. Anderson.
Thank you, Mr. Speaker. Introduction out of order.
You're recognized.
I'd like y'all to my wonderful desk mate, Representative McKnight, and his beautiful daughter, Reagan McKnight, who it's her birthday today, and she's here visiting her daddy. Just give her a warm welcome, please.
Welcome, lady. Happy birthday. Welcome. All right, further interrogation. Gentleman from Holmes, Mr. Clark. He's got an introduction as well. You're recognized.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, in the South Gallery, on behalf of the Holmes County delegation, we have Ms. Linda Salas and Ms. Martina Stanford from Holmes County. Let's help make them welcome.
Welcome, ladies. Good to have y'all. Lady from Jones, Ms. Scott. All right, you're recognized for your introduction.
Thank you so much, Mr. Speaker. Mr. Speaker, ladies and gentlemen of the House, I'd like for you to help me make welcome a lady who is a fantastic banker in Laurel, Mississippi. I owed her a lot of money at one time, Mr. Speaker, but thank God I don't owe her a dime now. Y'all please make welcome our great banker from Trustmark, Miss Fakewell Ball. She's in the South Gallery.
Welcome, lady. Good to have you here. All right, I don't see any further questions. You have further interrogation, gentlemen? I'll get right to you. I'm trying to finish up, ladies, through with her explanation. Anything further, lady, on the bill?
I just want to also say one thing. This isn't going to cost us anything. The Department of Health has gladly said that they would do this, and any monies that it's going to cost, in this bill it says it's coming out of the $119 million that we by contract are going to pay anyway. So I just thought I'd throw that out.
All right, you move final passage?
Yes, sir.
She moves final passage. Open machine, Madam Clerk. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Has everyone voted? Close the machine, Madam Clerk. By vote 118 yeas, 0 nays, the bill passes.